This is the famous rice farm of Ketu South in the Volta region of Ghana. A significant amount of the country's rice is produced here, and George Agbotadua has been working here for many years. One of the reasons why George is such a successful rice farmer is a relatively easy access to water, especially during the irrigation period.
When we start irrigating, water will be there for about 3-4 months.
An important source of water is the Lavi Dam a few miles away. It flows down to the farm through narrow canals and settles at the roots of the rice plants. Here, there is ample sunlight and the water is oxygenated, making it breeding grounds for the Anopheles mosquito that causes malaria. The female Anopheles mosquito lays its eggs on the surface of the water, which hatch into larvae. The larvae live for a few weeks before turning into pupae, which then transforms into an adult mosquito.
It's very important that everybody in Ghana knows about malaria.
Dr. Ebenezer Apiadintra heads Ghana Health Service, which has been monitoring the situation in Ghanaian hospitals over the years.
We go to the hospital, every annual review, malaria comes always as number one. And then when you look at the causes of death, it's also number one, especially among children under 5 years.
Stella Bonzi is a vegetable seller in Accra who lost Amma, her 2-year-old daughter, to malaria. She rushed her to hospital when she developed a high temperature with vomiting.
Doctor said malaria na ayamaban.
Unfortunately, Amma convulsed, fell into a coma, and died. Every day, 3 children under 5 years die from malaria in Ghana. These rice farms are ideal breeding grounds for countless mosquitoes as well as other insects. The situation becomes apparent when dusk falls. Meanwhile, on the other side of Ketu, dawn is approaching. Mr. and Mrs. Mensah have both been sick with malaria for a few days now. Mr. Mensah is a fisherman who relies on his daily catch for his livelihood. For every bout of malaria, which is frequent throughout the year, he loses an average of 5 fishing days. Mrs. Mensah also subsidizes the family income with petty trading, but she's too ill to work. Dawn breaks over Ketu. It is apparent that the land is dominated by lagoons and mangrove swamps. The rains also cause stagnant pools of water that become breeding grounds for the Anopheles melas mosquito. Malaria transmission is intense here. Mr. and Mrs. Mensah decide to go and see a doctor. Ketu South Municipal Hospital is not far from here, but the journey is quite an effort for them. They go straight to the outpatient department, the most crowded department at the hospital. Over 40% of the people here report the common symptoms of malaria, and the numbers have been consistently high over the last decade. Peter Mewu was the nurse in charge.
Actually, Mr. Mensah came in an hour ago with a complaint of vomiting, headache, fever, chills, and loss of appetite. The nurses record a temperature of 38.7, which is very high. So we're suspecting malaria. But then we asked them to do some lab requests for us, the full blood count and BF for MPs, to see if really he's suffering from malaria.
Before you are treated, get tested. It's very, very important. And this is important because we've branded every fever as malaria.
Testing for malaria is now a critical component in the fight against the disease in public health facilities. It is confirmed Mr. Mensah has a high count of malaria parasites in his blood and needs treatment. Mrs. Mensah also scored positive for malaria. They are both admitted and given an artesunate injection, followed by a course of artemisinin-based combination therapy, popularly known as ACT.
Mr. Mensah's condition looks very, very serious, but you'll be fine.
The dedicated staff here make sure of that.
Malaria is a very big problem here.
This is particularly so for children under 5 years old.
With complications, the child starts convulsing, and that one can cause a lot of complications to the brain. Sometimes you find that they grow up with some abnormality.
Cerebral malaria, which can be fatal, is quite common here at the children's ward. Northern Ghana. Prevalence of malaria is particularly high here. Together with Upper West and Upper East, the three regions recorded the highest number of malaria cases in the country in 2013, according to Catholic Relief Services. A few miles from Tamale, the capital city, is a sparsely populated district of Sanarugu, where dams, swamps, and pools of water have created highly conducive breeding grounds for mosquitoes. Abubakari lives here and earns his living as a shea butter farmer. For the last few days, he has been feeling sick. It seems today is his worst day. He can barely stand on his feet, let alone till the soil. For the next few days, Abubakari stayed at home, hoping he would get better. But he only got worse. In the nearby village of Taha lives Seidu, Abubakari's friend. He is lucky malaria has spared him because it strikes especially during the rainy harvest season when worker productivity needs to be at its highest. It is bad news for Abubakari because malaria would drastically affect his productivity and reduce his income. Professor Asante is an expert on the economic burden of malaria. We went to University of Ghana, Legon, to get a deeper insight into the impact of the disease on a poor farmer like Abubakar.
A person gets malaria. By default, the person has poor health. And the poor health means reduced efficiency, labor efficiency. And once there's reduced labor efficiency, low productivity. And the low productivity, output also goes down. And once output goes down, incomes go down. The sickness is sending a household into poverty.
Tamale. It's early evening and late commuters drive home from work. It so happens that the female Anopheles mosquito that carries the parasite that gives malaria frequently bites at night.
Mosquito malaria, no way. Mosquito malaria, no way. Hear me out, oh. Malaria.
It's another difficult morning for Abubakari as he struggles to get to the hospital. Arriving at the hospital is Wasila and her husband Abdul Razak. They are also from Abubakari's community of Sanarugu. Wasila has been complaining about chills and headaches for days. So Abdul, a carpenter, decides to take the day off and take his wife to the hospital. There is also Rukaya, who is 7 months pregnant. She came along with a small son. It's quite a wait at the OPD before they see the doctor. Abubakari is first. Dr. Barakisu Seidu asks if he has been sleeping under an insecticide net. He says no, but promises to get one. Abubakari is pale and possibly anemic. Dr. Seidu sends for further tests. Wasila has sleepless nights with chills and severe headache. Dr. Seidu is concerned because her blood pressure is also rising. Again, she sends for further tests. It's Rukaya's turn.
She was also sent for a test. They all tested positive for malaria.
Meanwhile, more patients have arrived to see the doctor. Back at Ketu South Hospital in Volta region, Mr. and Mrs. Mensah are well enough to be discharged. It has been quite an ordeal, but they are truly glad it's over. In both rural and urban settings, mosquitoes breed in all sorts of places and quite surprisingly, inside the school well. We spoke to Mr. Julius Klomega, head teacher of EP Basic School in Keta Municipal.
Early morning, You lift it like this, you see mosquitoes coming out from the wall just like that.
Mosquitoes can also lay their eggs and multiply in quite unique places. Inside discarded motor car tires, plastic bottles and cans, garden pans, and even the folds of leaves. The Anopheles mosquito that carries the parasite that gives malaria, however, breeds best in stagnant water in sunlit places such as the trenches of vegetable farms and even potholes in the road. Back in Sanerugu, Rukaya is happy to start her course of ACT. National Malaria Control Program, NMCP, is a lead agency for malaria control in Ghana, working with international partners such as World Health Organization,
Rollback Malaria, USAID, UKAID, UNICEF, and the Global Fund.
Dr. Constance Bart-Planche is program manager.
The goal of the malaria program is that by the year 2020, we would have reduced the malaria diseases and deaths by 75%. And we are using the baseline figure of the year 2012. To attain this goal, we have put in place some interventions, preventive and then the cure. We believe in prevention. But should you get the disease, we also have the methods and the treatment to cure the disease.
On prevention, the strategy is focused around promotion and provision of insecticide-treated mosquito nets, also known as ITNs.
We are encouraging the use of the treated mosquito nets by everybody.
The record has been impressive.
In 2003, the DHS survey showed that only 3% of children under 5 years were sleeping in the treated mosquito nets. In 2015, this has shot up to 60%. We've made remarkable progress.
We visited an NMCP community outreach program in Volta region where the mass distribution of insecticide nets was combined with health education, particularly malaria prevention and free testing of the disease.
The malaria levels are high, and that is the more reason we actually wanted to come down to the community to offer these services.
As you expose people to information, you know that behavior change takes time. It's a process. It's a way of reminding the community that these are the preventive measures. Don't forget about them. Use them as to protect yourself to prevent a disease that is preventable.
There is also indoor residual spraying, intermittent preventive treatment in pregnancy, seasonal malaria chemoprevention, and personal protective measures. Once a person is infected with malaria, the treatment of choice is artemisinin-based combination therapy, or ACT.
In the late 90s and early 2000s, we found out that chloroquine, which had been the main drug that we were using, was virtually ineffective. So we conducted other studies, and that's where we got onto amodiaquine, artesunate, and lumefantrine and things which we are using now. Fortunately for us, we are seeing in excess of 95–96% responses to the treatment, which is what we expect. So far, so good.
From 2010 to 2015, we have recorded about 45% reduction in malaria deaths. And this shows that the malaria medicines are really working.
There is, of course, an exception: pregnant women.
For pregnant women, we encourage them to be serious with malaria medication, especially because malaria can be very disastrous to the mother and the unborn baby. So for the first 3 months, we advise them to take quinine. After 3 months, they can take the ACTs when they get malaria.
For about 3 years consecutively, the Volta region has not seen any pregnant woman dying from malaria. And the number of children under 5 who also die from malaria has gone down drastically in the Volta region. And we think that the interventions that we are putting in are yielding a lot of positive results.
These are impressive results, but it is important to sustain the current gains by increasing investment in malaria control.
When I was sleeping, I was bitten by a mosquito. I didn't know some small parasites entered into my body.
Public education on malaria prevention is one of the key tasks of NMCP. Here at EP Basic School in Angron Afiadenyigba, the children are watching an exciting animation video that highlights the essential messages. It is also the case that malaria is a major cause of absenteeism in schools.
We are involving the teachers also, because teachers must also get the knowledge in terms of the information on malaria.
Malaria control and the work of NMCP have been very much enhanced by the work of research organizations such as Noguchi Memorial Institute for Medical Research.
There are so many forms of the parasite, and the parasite is able to change from one form to another, and when it does that, it's able to hide from our body's natural defenses. One arm of the studies that we do here is to be able to track these parasites, and that sort of feeds back to inform what tools that we need at every point in time to be able to effectively control the disease.
Malaria control, led by NMCP, has achieved many successes, including increased ownership of nets, improved malaria treatment, and a drastic reduction of deaths amongst children under 5 years.
About 15 years ago, for every 100 cases of children under 5 being admitted in the hospital, we found about 15 dying. But now it's 0.5. You can imagine that. So if it's gone down drastically, and because of the way malaria is treated.
It is also clear that the national malaria prevalence rate of 26.7% recorded by DHS is too high, whilst the economic cost of malaria to businesses and sustainable development is devastating.
25% of all incomes in all malaria endemic countries, including Ghana, household income, is spent on combating malaria.
The moment we take malaria off our disease burden, we save quite a lot of money that could go into supporting other diseases.
And not too long ago, the global economy suffered an economic crunch, which means that resources are dwindling.
That is where the dwindling of global funds presents a unique opportunity to mobilize country-based funds, particularly from the private sector, to step up the fight against malaria.
XYZ Breakfast Show 93.1 megahertz, 11 minutes to 10. Today, 25th of April, is World Malaria Day. For half the world, every day is Malaria Day, a day to keep up the fight against this killer disease. While efforts to prevent, diagnose, and treat malaria have gained important momentum over the past years, shortfall in funding threatens to slow down progress, particularly across Africa, where high-burden countries are facing critical funding gaps. The theme for this year 2016 is End Malaria for Good.
Invest in malaria. A special health summit is in progress. There is renewed determination.
All must come on board to ensure that this fight is successful, the fight against malaria.
One of the speakers is Prince Kofi Amwabing, a leading Ghanaian businessman and president of UT Holdings. He is a malaria ambassador. Like most Ghanaians, he has unpleasant memories of malaria.
Inactive for at least about 3, 4, 5 days at a time. And it comes with at times a bit of, certainly some headaches, some neck pains and running tummy and general pains in the body. I'm quite resilient in that sense. I will take my malaria to work, but obviously the output is not the same. For other people, it can be quite fatal.
He is particularly concerned about the impact of malaria on businesses.
The cost of malaria to businesses in Ghana
is $6.6 million a year.
I think I can say that there's no point in time, there's no day that malaria doesn't get one person or some people to absent themselves from work. And if you look at it, the number of days that we've lost to malaria, as in man hours and man days, is quite a lot. It's something we have to deal with. We have tried to put our staff on medical insurance, but it still means they have to go to the hospitals and take their excuse duties and they cannot come to work. So it affects the staff and the general output of the whole company. It affects the departments, therefore it eventually affects the whole company. On the other side, as in our customers, I mean, we expect them to apply the monies we've given them to do their business and to be free to move to attain whatever targets they set themselves. And we've had instances where you go to the client to pay a normal call and they refer you to the hospital.
Prince Amwabing strongly believes that it is important for businesses in Ghana to contribute resources to the fight against malaria.
It is very important that, and it's not only in our type of business, in any other business, in government, public service, everywhere, malaria does put people away from work, does affect productivity, and therefore there's a general impact on the whole economy. And name it, in any aspect of the business, in any industry, the effect is quite devastating.
There is consensus amongst its peers. 98% of business leaders have expressed the need for increased investments to control and eventually eradicate malaria.
The contributions from government, from external sources, the Global Fund, and from other businesses so far has never been enough. Even though it's helped in controlling malaria, these funds have never been enough. What is more serious at this time is the fact that the funds are even not going to be in the same quantum as they were, because the Global Fund and other donors will actually curtail how much they're giving us, because now we're a middle income country. We have to rise to the occasion, and therefore I am appealing to businesses to actually fill this gap and let the effort at controlling malaria sickness continue in the same vein, so that we will have certainly no deaths in malaria and have the malaria disease under control and possibly eradicate in the years ahead.
It is important that businesses also support and invest in malaria preventive measures such as insecticide nets and tailored behavioral change activities for employees and dependents.
Also committed to the campaign to control and eventually eradicate malaria is Dr. Joyce Aye, former head of Ghana Chamber of Mines and women's advocate.
For business, it's a real killer. It silently steals from productivity. And it is very important for us to look at it from that perspective. You know, how many hours we lose as a nation because people are suffering from an avoidable disease, a disease we can do something about. Somehow we seem to take it for granted that we live with it. You find that it's so debilitating that it doesn't matter how many times you've suffered from it. Once it hits you, you can't do anything, you can't work. What I'd like to tell all of us in the private sector is that a healthy body is what helps build a healthy and prosperous nation. Supporting the malaria program is actually supporting the well-being of the human resources that are so critical for the work that we do. And so really, it's a win-win situation.
We spoke to Mr. Pitosei, Managing Director of UT Logistics, and some members of staff to further understand the economic impact of malaria.
Our clients depend most on the timelines that we give them. And so if you have somebody who's off sick because of malaria and you don't have a replacement, what it means is that you will not be able to meet the client's deadlines.
My work involved a lot of walking, a lot of action work. So I was a bit dull walking, I was a bit dull talking to my colleagues on the field, and it really affected me.
Nanama Kunedu is Assistant Clearing Manager. As a mother and worker, she brings another important insight into the impact of malaria on businesses.
It's a bit challenging when you get a family member who always gets malaria and then you have to take care of them. You have to ask permission, meanwhile you have work to do at the office and you take them to the hospital before coming to work.
Most often, it is a son insurer who gets sick with malaria.
I couldn't come to work because I have to be with him because the temperature was up. He couldn't eat the whole day, so the whole day output was zero.
Mr. Kofi Blanksing Okanse is an independent international consultant. Like most Ghanaians, He has telling experiences of malaria.
So without being able to concentrate, pretty much your day is gone. And the other thing too that we do, which I think is interesting for this, is that we interact with a lot of clients who are also quite busy people. So it's quite difficult to get on their schedules. And so on a day that you are not functioning properly, it might take you another month or two to get on your client's schedule. And you can imagine how disruptive to your business and to their business that actually is.
He has also decided to join the fight against malaria because it makes business sense.
In addition to the physical impact on you, it's economically quite costly as well. I mean, if everybody in this office, the 5 or 6 of us in this office, each get malaria, cumulatively, the losses to the business are on the order of 5 to 10% of our revenues.
Malaria is dangerous. We know it. Malaria is a terrible disease, and we must do everything to really fight it and eradicate it.
Defeating malaria requires the commitment of all, and there is widespread support for mobilizing internal funds to step up the campaign. A malaria-free Ghana is a vision shared by all.
Private sector, this is your time. Get involved and let's rid this nation of this killer, silent as it is. It really is ruining a lot of our businesses.
In our fascinating journey to understand and mobilize against malaria, perhaps the most enthusiastic support symbolizing the future came from the school children of EP Basic School in Volta region. They created a simple but unique message read beautifully from the skies.
Mosquito malaria, no way. Mosquito malaria, no way. Hear me out, oh. Malaria they kill, oh. Sleeping under treated nets be the deal, oh. Live a healthy life, don't make it catch you, oh. Cause if it catch you, you know go like the way you go feel, oh. Mosquito malaria, no way. Mosquito malaria, no way. Mosquito malaria, no way. Mosquito malaria, no way. Hear me out, oh. Malaria they kill, oh. Sleeping under treated nets be the deal, oh. Live a healthy life, don't make it catch you, oh. Cause if it catch you, you know go like the way you